Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Absolute Rehabilitative Therapy in Greenbelt, Maryland, discussing the benefits of physical therapy and how it can help relieve the pain resulting from injuries and ailments without surgery and with minimal downtime, with one of this region's top rehabilitative therapists, Dr. Derrick Martin. Dr. Martin graduated from Howard University in Washington, D.C. with his undergraduate degree and received his doctorate degree from A.T. Still University School of Allied Health, which is located in Mesa, Arizona. Dr. Martin is a member of the American Physical Therapy Association, among others, and again is widely recognized as one of this region's top rehabilitative therapists. Welcome, Dr. Martin.
Thank you. It's glad to be here.
Oh, it's our pleasure to have you on our program. We've got a lot to talk about. We've got 3 patients, in fact, joining us a bit later. But I wanted to begin, if I may, by asking you if you can please tell us, for those who may not know, what physical therapy is.
Sure. Physical therapy is the art and science of treating physical ailments and disabilities with modalities and therapeutic exercises.
Now, are there varying types of physical therapy?
There are. There's acute care, subacute care, home care, outpatient. There's pretty much a lot of different areas that one can venture into. Depending
on each specific patient's needs, obviously.
Exactly.
And what modalities do you here at Absolute Rehabilitative Therapy provide for your patients and for the folks out there?
We have pretty much everything. We have traction, cervical, lumbar. We have laser, ultrasound, paraffin, definitely exercises, and we just do a lot of manual therapy as well.
And what types of problems and pain that folks are experiencing out there, Dr. Martin, do these treatments and your practice help?
Okay. Well, we treat areas as far as car accidents, motor vehicle accidents. We have patients with cerebral palsy, with joint problems, gunshot wounds, carpal tunnel syndrome, tarsal tunnel, plantar fasciitis. Basically a lot of strains and sprains, a lot of different things. We have a pretty good variety of things that we treat here.
So basically it's quite broad. In other words, a lot of different folks could benefit from the treatments that you offer here.
That's correct.
Who are suffering from pain.
That's correct. We treat babies to the elderly. We have a very large spectrum of our patients here.
So a lot of folks that would be candidates.
Exactly.
And what are some of the benefits, would you say, Dr. Martin, of physical therapy compared to some other treatment options that are out there?
Well, I think with physical therapy, it works. I'm not saying other things don't work, but we've been proven. Patients come in, they get assessed, they get treated, and they have good results. And I can't really speak for the other options, but I know that what we do works.
Well, that's certainly very good to hear. And speaking of patients, we're now going to meet 3 patients of Dr. Martin. Welcome, Lynn. It's a pleasure to have you on our program.
Thank you so much. It's a pleasure for me to be here also.
Oh, thank you. We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I wanted to begin by asking you, Lynn, what problem or problems were you experiencing that brought you to Dr. Martin and Absolute Rehabilitative Therapy here?
Okay, I had broken a bone in my ankle this past January, and I didn't go into therapy. I didn't have surgery, but I had a fall on August 8th, and I broke my ankle. I dislocated my ankle, broke it in 3 separate places. So I had to have emergency surgery, which I had with Dr. Dr. Bernstein, and he actually had to put in a plate and 7 screws. And I've been coming here to Dr. Martin's for over 2 months now, and I'm so happy with the results. He's a wonderful doctor, and his staff are just fabulous, all of them. And it's really been helping me because I've just started slowly, as if walking all over again.
My
With
goodness.
my ankle, yes.
You went through a lot there.
Yes, I did, yeah.
And so when you came here to Dr. Martin and his staff, what happened? Obviously, you were suffering from pain from the injury.
Right.
And what happened? Just so the folks out there that are watching will get a little idea of what takes place.
Right. He looked at the x-rays, and I mean, we spoke for probably a good half hour about the pain that I have, what happened, and what he can possibly do to help me out. And it's amazing because my ankle is now feeling so much better. He's such a wonderful doctor. I don't feel out of place. I can speak with him, ask him certain questions if I don't understand. And like I said, I could not walk for probably like 3 months, my ankle, because it was broken.
My goodness, it obviously affected your life greatly.
It did. Yeah, could not go to work. But Dr. Martin here has been helping me out tremendously, and I need another surgery in probably 2 or 3 weeks from now to remove the 2 long screws that are in my foot.
Okay.
And then I'm going to have to start all over again, and I'm definitely going to come here.
And
Dr. Martin.
And what treatments have you been undergoing here?
Oh, he has been putting, I probably won't say it correctly, electrodes, and that really helps to, the blood flow in my ankle, and then he gives wonderful massage. That seems to really help a lot. And after that, slowly, I do exercises with my foot. I'm on the bed, I'm just pulling my foot, turning it, exercising. Now I was on crutches. And I have not been on crutches for a while.
Congratulations!
Yeah.
You're off the crutches.
I'm off the crutches.
You're here.
Yeah.
You're getting the healing is
so
happening.
Happy. Yeah, and I'm happy. I don't want surgery again, but I'm so happy to be. I'll be coming back here again because they're wonderful. I really, enjoy them.
That's wonderful. And for the folks out there that are watching, obviously, as you've already expressed a few times, your experience has been wonderful here with Dr. Martin and his entire staff.
They're so flexible. They're just, and he definitely knows, how to treat patients.
Well, we're very happy to hear that. And on that note, Lynn, keep getting better.
Yes.
Keep healing.
Yes.
And thank you for joining us and being a guest on our program. It was our pleasure having you on.
Thank you so very much. Have a
Thank
good day.
You too. Welcome, Diane. It's a pleasure to have you on our program as well.
Thank you for having me. It's a pleasure to be here.
And I wanted to begin by asking you as well, Diane, what were you going through or suffering from regarding pain that brought you to Dr. Martin?
Well, I actually met Dr. Martin in a different way than probably most patients. I wasn't coming to see him for a particular health issue, but I was referred to him by a friend who had been to him, and she raved about what treatment he had given her. She was having some foot pain, and he was using some of the products that I represent, which is Arbonne. These are health and wellness skincare products. So I approached Dr. Martin about purchasing or using the products, and I gave him some samples. He tried them, and he liked them, and so now he's incorporated the Arbonne detoxifying skincare oil in his practice. But then just recently, about 2 or 3 months ago, I've had issues with carpal tunnel. I work on the computer for like 8 hours a day, and I was having some issues. I had physical therapy before, and in 2007 I had surgery, but the pain was still there. So I decided to come to see Dr. Martin, and he's really done great wonders with my hand, with the ultrasound, the exercises, and so I've been very pleased with that.
Well, we're certainly very happy to hear that. And as far as the treatments themselves, as you just touched on, the ultrasound and the other treatment remedies, how often do you come and how long do they typically take for you?
Well, I've been seeing him twice a week. And usually my treatments or and my exercises total is like a half hour to 45 minutes. So it's pretty painless. It's, they're very accommodating. I can come after work. They have several appointments after work. So he works in various locations. I know he has an office here and in Waldorf. So he and his staff are very accommodating and can't do enough to make you comfortable.
Well, certainly sounds like you're very pleased with your entire experience, not to mention the results.
Yes, my hand is much better since I've been seeing him.
Well, on that note, I'd like to thank you, Diane, for joining us and being a guest on our program as well. It was a pleasure having you on.
Thank you very much. It was my pleasure too.
Thank you. Welcome, Ina. Thank you for joining us today.
You're welcome.
I wanted to begin by asking you the same question I asked Lynn and Diane, and that is, what were you suffering from that brought you to Dr. Martin?
I was suffering from pain in my toes and the bottom of my feet, of my foot and my ankle.
My goodness.
And I had been suffering for about a year before I finally brought myself to the doctor.
Was it pretty bad, I take it?
It had gotten pretty bad.
Oh, over that time.
Over that time.
My goodness. So you're talking about the toes, the bottom of the foot, that whole region.
It ended up tendonitis, a little arthritis, and falling arch.
Oh, my goodness. So then you came here to Absolute Rehabilitative Therapy with Dr. Martin.
Yes.
And tell us about what took place.
First, I was impressed with his staff. He hires a lot of the young people, and I was very impressed with the professionalism of the young people that he hired. The front desk staff, I was impressed with them. The treatment, I never had to wait more than 5 minutes when I got in. The treatment was wonderful. I wanted treatment on the other foot too.
Well, speaking of treatments, what treatment did you have done?
I had, it started with an ice pack.
Okay.
And then it was sonogram, and then there was a series of exercises that I had to complete each time.
Okay. And then how long did you go through these exercises and treatments?
Went twice a week for, I kind of lost track, but I guess it was about 2 months.
Okay.
Maybe 2 months, maybe a little less, I'm not sure.
And how do you feel today?
I feel great. I mean, two of the issues, the falling arch is still there. But the other two, I have no more pain in the toes, no more pain in the bottom of my foot. But because of the arch, I think the ankle pain, I had to get a cortisone shot for that.
Sure. No, I understand. So basically 2 out of the 3 areas that you've been suffering from have been eliminated.
Yes.
The pain is gone. You're feeling a lot better. You're walking a lot better.
Yes.
And the third area is something that's basically the falling arch area that you're working on with the doctor. And for the folks out there that are watching, what would you tell them, again, if I may ask, regarding Dr. Martin and the whole staff here? Because I know you expressed it a few moments ago, but for anyone out there suffering from what you're suffering from, what would you say?
Great staff, great treatment. I would highly recommend them. If I ever needed therapy again, this would be my first choice.
Well, on that note, I'd like to thank you as well, Ina, for joining us and being a guest in our program.
Thank you.
It's our pleasure. We're now back with Dr. Martin. I must say, all 3 of the patients, Lynn, Diane, and Ina, very pleased with the results, and the pain is gone.
Good.
Now, how long do the sessions typically take that you offer here? And I know I preface that by saying that I'm sure it varies based on each patient, what his or her needs are, what types of pain they're suffering from. But in general terms, what is somebody looking at?
Well, in general terms, if someone comes in, we always try to get them out of here in an hour and a half.
Okay.
Okay, because some less, but for the average, an hour and a half, because we understand that, they have to go to work, they have other appointments, they have schedules as well. So whenever they call to make an appointment, we always let them know that they can always make appointments after an hour and a half, and they'll never be late for those appointments when it comes to our practice.
I got you. That's good. That's like worst case scenario as far as length of time. Because as we know, Diane, for instance, I think she said it only takes her about 40, 45 minutes. So it can be a lot less depending on the treatment.
Exactly.
And how many visits are typically required? And again, I understand that varies as well based on each patient, but in general terms.
I would say it definitely varies. We've gotten patients better in 1 visit. I would say the average is probably 12 sessions.
Okay, and they're like, what, a couple each week, basically?
2 times a week, 3
Two-
times a week, depending,
Okay.
again, depending on the patient's injuries and their needs.
Now, the 3 patients that we spoke to here a few minutes back, obviously were very pleased with the results, and I take it, I wanted to ask you if that's typical as far as the type of results that your patients see.
I would say yes. Of course, we're not 100%, but I would say we're probably high in the 90s as far as getting our patients better.
Well, that's a very high percentage, in fact, a very high success rate compared to a lot of the other options out there.
Yes, we're pleased with our percentage.
Yeah, because I mean, when we think about it, you know, we're talking foot pain, carpal tunnel, other types of aches and pains and sprains like you mentioned earlier. It can be debilitating in several cases to the point where it affects one's life. So to come here, to know that there's treatment options that are only a couple of times a week, no more than an hour and a half tops, if not less, and leave here feeling a lot better, and eventually, in some cases sooner than later, the pain completely gone. I think there's no price you can put on that. It's invaluable.
I agree.
It gives us our lives back, basically.
Exactly.
Now, are these results permanent as far as after they go through the exercises and the treatments and the pain's gone, or are there chances it can come back?
There's always chance that they can come back. It's based on their lifestyle. If you go to therapy, you get better, and then you don't do any activity for 6 months, and then you just decide to go play basketball, you risk re-injuring something or injuring something new.
Yeah.
So it all depends on the lifestyle that the person lives and the exercises that they do after therapy.
Well, that's very interesting and certainly good to know, Dr. Martin. We're literally out of time, but I wanted to ask you before I let you go, you and your practice here, Absolute Rehabilitative Therapy in Greenbelt, Maryland, and in fact, you also have a location in Waldorf, Maryland.
That's correct.
So you're basically covering this whole region, including Southern Maryland.
Yes, sir.
For folks out there that are watching. You've certainly developed a reputation for excellence in patient care. You're recognized as one of this region's top rehabilitative physical therapists. I just wanted to ask you, what would you say, Dr. Martin, help separate you and your practice apart from many of the others?
Well, I think, like our logo says, we put the art in heart. We truly care about our patients. Each patient is seen as an individual. They're seen differently. And we actually listen to their needs, because anyone will tell you if a patient has a problem and you listen to what they're telling you, 9 times out of 10 they will tell you what the problem is.
Yeah.
And let you know how to fix it.
Yes, indeed. That's a point that cannot be emphasized enough, because there's a lot of folks out there that it doesn't work that way with. And it's great to hear that that's how you built a big part of the reason why you built your reputation the way you have, because not just the 3 patients today, but from our research we found you all really do care about your patients. You go the extra mile. You listen to each and every one of them. They meet with you as well as your wonderful staff. And as we heard from them earlier, they were rave reviews about Absolute Rehabilitative Therapy. And on that note, I'd like to thank you, Dr. Martin, for joining us, being a guest today, and educating us on different treatment options, on how we can eliminate pain through the options that we discussed. And thanks again.
Thanks for having me.
Our pleasure. Love to have you back on in the future.